Do you have hard, tight, painful muscles that won't go away, either following an injury or just developing over time? Do massages sometimes help you, but sometimes actually make you feel worse? Well, you might actually have something called trigger points. So, this is a very brief four-part series where we're going to discuss these. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, trigger points are something that I have been managing in my patients for well over 2 decades. Now, please remember these videos are not a substitute for an evaluation, an examination, for diagnosis, or for treatment. These are only for educational and informational purposes only. Seeing the wrong provider can result in an incomplete diagnosis, the wrong treatment, and sometimes persistent suffering. So in this four-part series, we're going to cover, beginning with this one, what a trigger point is. Then we're going to discuss trigger points as it relates to headaches. Secondly, we're going to look at another condition, trigger points and whiplash. And then in the last and final video, we're going to discuss chiropractic care and self-care strategies for trigger points. So let's begin. In 1955, a young senator went and visited a medical physician named Dr. Janet Travell. Now, Dr. Janet Travell was trained as a cardiologist, but starting in the 1940s, she developed a special interest in studying something that's called myofascial pain. And she started researching it and started developing different treatment techniques. This young senator suffered from lower back problems and he struggled to walk. Now, the back problems began sometime in college, more likely than not due to some football injuries that he sustained, possibly even some injuries maybe playing tennis. However, things really worsened during World War II. See, he enrolled in the Navy and he served out in the Pacific. And one night, his small boat was hit by a Japanese destroyer, breaking the boat in half, and several of his crewmen died. His back was further injured from this one. This young senator was from Massachusetts, and he was concerned about his presidential aspirations. See, he wanted to go on and run for president, but he had a hard time walking and he had low back pain. This senator's name, you may have already guessed it, was John F. Kennedy. And he saw Dr. Travell in 1955. So she evaluated him. And she noticed right away that he had tight muscles and he had one leg shorter than the other. Now, she sounds an awful lot like a chiropractor, doesn't she? Looking at leg lengths and looking at posture and looking at biomechanics, but she wasn't. She was a medical doctor. So she began treating him. She prescribed a rocking chair to relieve his lower back and started doing injections with medicine into his tight muscles. And she even did other types of treatment called dry needling, breaking up some of the muscle spasms. It was so successful for this young senator that when he finally did win the presidency, he invited Dr. Janet Travell to be his personal physician, and she was for a few years. So, what can we learn from this story? Well, what we can learn is that there are a lot of painful conditions that can originate from muscles. And, oftentimes muscles are not really given a whole lot of attention unless you're the patient that's suffering. Painful muscles can limit you in all of your activities. Not all of us are going to end up running for president, but a lot of us want to just simply run. Some of us just simply want to move. So let's talk a little bit about what trigger points are. So trigger points are very painful nodules within the muscle. They exist in very well-known locations within each muscle belly. And the muscle belly is what's right in the middle. And then they also have this unique characteristic of where they can send pain off to a remote location. Now, it's not really radiating pain. It is called referred pain. So the referred pain is pain that gets spread. And even the direction and location of this referred pain is very well documented and is different from muscle to muscle. So how do these things develop? Well, they can develop due to blunt trauma, or they can develop due to repetitive trauma. So for example, like this young senator that we're talking about, he had some very physical trauma to his body when his boat was crashed into, but he also had probably repetitive trauma from playing football. In our patients, we sometimes see that they do certain repetitive motions over and over again, and that can create damage within the muscles that are moving in the same direction over a prolonged period of time. Something else that can happen is you can damage the muscles with prolonged postures. So, such as sitting. Sitting in one place for too long, being on the computer, you can start to develop strain in one part of the body and not enough tension in another part of the body. That, in turn, will damage some of the tissues. We also know that prolonged anxiety and prolonged psychological stress has an impact on the muscles. You can also develop trigger points from that. And lastly, another one that seems to play a big role is lack of exercise. So, muscles, when they are exercised, they stay supple, they stay long, and they stay healthy. When you do not exercise muscle, when you do not use it, it starts to kind of wither on the vine, so to speak. It starts to get stiff, hard, and tight, and loses its flexibility, and hard, painful nodules can develop in that. So, when we go and we do some studies on these trigger points, they'll find out if they put needles into these hard nodules that are painful on the patient, there's increased electrical activity. So there is a objective basis for these things to be very active and very painful. And finally, what's really interesting with a lot of trigger points, oftentimes patients do not have the vast majority of their pain at the trigger point. It's at the referred location. Meaning, as we'll find out, if you have pain in the shoulder and there's trigger points in the shoulder, oftentimes you won't notice the pain in the shoulder as much as you will notice the pain going down the arm that's coming from the trigger points. And that can lead to a misdiagnosis where the clinicians all think that the patient has a pinched nerve somewhere. And while they may have a pinched nerve at the same time, failing to address the trigger points that are in the shoulder, causing additional symptoms down the arm, results in the patient, once again, having an improper diagnosis, ineffective treatment, and living with symptoms that they don't need to live with. So that explains, in summary, what some of these trigger points are and where they come from. So I hope you found this helpful. You have a lot of voices to pick from, and I'm honored that you chose this one. So until the next time we meet, have a wonderful journey and be blessed.